The immune system that typically attacks bacteria and viruses attacks now the insulin-producing cells of the pancreas.
Hello everyone, it's me, Samantha Purbor, and welcome to another episode of Let's Talk Wellness with Watsons. Did you know that kids can also be diagnosed with type 2 diabetes? In today's episode, we'll explore how this happens and discuss various ways on how to manage this disease. But before we get into that, remember to follow us on Facebook, Instagram, and TikTok, and subscribe to our YouTube channel for more health tips. I'm sure that a lot of us are very familiar with diabetes in adults, but for parents with kids who are diagnosed with diabetes, it can be tricky and sometimes even overwhelming. So joining us here today to help support our kids as they navigate life with diabetes is an internist and endocrinologist. Please welcome Dr. Chok Montevirgen. Hi, Doc. Welcome.
Hello, Sam. Hello, everyone.
Doc, first off, what do we need to know about childhood diabetes?
Let's define diabetes first. Now, diabetes or diabetes here in the Philippines refers to a group of diseases that actually affects how the body uses blood sugar. There are different types of diabetes. The ones that we are familiar with, yung gestational diabetes, where women, when they get pregnant, they get this type of diabetes. There are many special types of diabetes, but the two most common types are type 1 and type 2 diabetes. Type 1 diabetes typically affects the younger age group, while type 2 diabetes naman affects the older age group. Although these two types of diabetes are different, the symptoms are similar, and the way they are tested are also similar, and also the targets. Of course, there will be some laboratory tests that will help us distinguish between the two types of diabetes.
Grabe no, Doc. Ang dami pa ng mga types of diabetes. But can you tell us more about diabetes in children?
Type 1 diabetes is the most common childhood metabolism problem. About 1 in every 400 to 600 children and adolescents has type 1. The World Health Organization reported in 2021 that there are around 8.4 million individuals that has type 1 diabetes, and out of the 8.4 million, 1.5 or 18% were younger than 20 years old.
And now, Doc, can you further elaborate on the differences between type 1 diabetes and type 2 diabetes, please?
Type 1 diabetes is an autoimmune disease, meaning the own body will attack the insulin-producing cells of the pancreas. Hence, there's deficiency or kakulangan sa insulin. Because we lack insulin, patients with type 1 diabetes will need lifelong injections of insulin. Anyone at any age can develop type 1 diabetes, although there are two peaks in the onset of type 1 diabetes, around 4 to 6 years old and around early puberty, 10 to 14 years old. The exact cause of the diabetes type 1 is unknown, but we know that it is an autoimmune disease in which the immune system that typically attacks bacteria and viruses attacks now the insulin-producing cells of the pancreas. On the other hand, type 2 diabetes naman is a multifactorial disease wherein it involves the heredity and, of course, the environment, ultimately leading to insulin resistance and eventual rise in your blood sugar. Although patients with type 2 diabetes typically is treated with oral medication, some will need insulin treatment as well.
Doc, you mentioned a while ago that there is diabetes in children. How important is it to detect it early in their life?
It is crucial to diagnose diabetes early in life because complications can occur if the patient is not treated properly. In fact, a lot of type 1 diabetes are diagnosed during the time of emergency wherein they develop hyperglycemic crisis known as diabetic ketoacidosis as a result of the lack of insulin in their body.
Doc, now that we know the differences between type 1 and type 2, what are the other complications naman?
Diabetes complications are generally divided into micro and macrovascular complications, meaning yung mga maliliit na ugat at saka malalaking ugat, which basically affects everything in the body that has blood flow. Diabetes is the number one cause of blindness, mga nagdadialysis, and also non-traumatic amputation of the feet. It is also the leading cause of coronary heart disease and even stroke. Diabetes also increases incidence of other metabolic diseases like hypertension and dyslipidemia o mataas na cholesterol.
Grabe no, Doc. There's so many things to watch out for. How about for children? What are the common symptoms to watch out for?
Okay, now for kids, the most common symptom of diabetes include high levels of sugar, either sa blood or sa urine during testing. They also complain of abnormal thirst. Parang lagi silang nauuhaw. Also, kung parang tingin mo sa bata, parang siyang dehydrated, the frequent urination. Parang lagi silang nagugutom and they lack energy because all the sugar is in the blood and not in the cells and the tissues. So they feel that they are always tired. There will be complaints of mood changes. Also, naman notice natin in relation to the dehydration and frequent urination, yung baby na madalas nag-change ka ng diaper unlike before, or yung bata na previously toilet trained, suddenly nagbe-bedwetting or madalas mag-urinate sa pants. And of course, because diabetes also affects the eyes, kids may also complain of blurred vision.
And Doc, in case parents do see these symptoms, what are the next steps that they should be taking?
Type 1 diabetes can cause sudden extreme swings in blood sugar. So if yung parents ma-observe nila yung mga symptoms that were previously mentioned, it is important that yung parents dalhin nila yung anak nila sa doctor for proper physical exam and laboratory testing so the doctor can start proper treatment right away.
So now you heard it from Doc. Once you see these symptoms, be sure to get in touch with your doctors immediately. Doc, let's go back to type 1 diabetes. How can we help our children manage it properly?
Okay. Well, Sam, we are now living in a modern age of diabetes care. Unlike before insulin was discovered, having type 1 is actually an endgamer for kids. But in the modern age, we have professionals, we have doctors, and we have nutritionists, dietitians that will help our kids live a normal life. For patients with type 1 diabetes, the Philippine College of Endocrinology, together with the Philippine Center for Diabetes Education Foundation, hold an annual camp for patients with type 1 diabetes called Camp Coke, where children with type 1 diabetes come together and mingle. The main aim of this camp actually is to help them learn about type 1 diabetes through lectures and play. And of course, the parents are also involved wherein they also receive lectures and they learn na yung mga kids, they would learn na they are not alone, that there are also other kids experiencing the same thing.
Doc, now that we understand diabetes a little more, let's talk about the insulin shots this time. So what exactly does it do to the body?
Having type 1 diabetes means you are not producing enough insulin for the metabolic needs of the body. So therefore, you'll be injecting insulin lifetime. Insulin is a hormone that lets us use sugar in the blood. So without insulin, lahat ng sugar nasa blood lang and will not be used by the cells or the tissues to make energy. So without energy, the body will feel weak, no? Because we lack energy because all the sugars are underutilized. So it will lead to complications.
And Doc, is it true that having an active lifestyle will help manage diabetes better?
Regardless of the type of diabetes, moving our body through exercise and physical activity will help us utilize the sugar in our body. Exercising also stimulates the muscle to use the sugar for energy, hence decreasing the sugar in the bloodstream. Exercising will also improve insulin sensitivity and also decrease the incidence of obesity.
And Doc, how about type 2 diabetes? I do understand that it's more apparent in adults, but it also happens in children. How can kids manage it better?
It is both hereditary and a lifestyle disease, meaning having a parent being diabetic will increase or massively increase your risk of having diabetes. In fact, if one of your parent is diabetic, it already increases your risk of having diabetes by around 40 to 50%. And if both parents are diabetics, it increases to around 70 to 80%. Modernization also play a role in the development of diabetes. As you can observe, no, around yung mga restaurants, everything now is unlimited, no? Only rice, only drinks. So the kids will actually be taking too much calories in one sitting. Parents bring these kids to restaurants and they can eat, for example, 2 pieces of chicken with 2 servings of rice with large soft drinks. And then their pancreas is still young. No, it might not handle that amount of calories. And then that would be just, for example, for lunch. And then for dinner, they'll be doing it again. And they'll be doing it every day. So just like anything in this world, the pancreas will overwork and anything that is overworked will eventually fail. So pag nag-fail na yung pancreas nila in producing insulin, that's when diabetes type 2 ensues.
And Doc, are there supplements that can help with the management of type 2 diabetes?
Proper guidance from a registered nutritionist, dietitian, and your doctor may help guide you in choosing the right set of supplements and nutritional products to help you maintain and manage your blood sugar.
Doc, what are the things that we can do to lower the chances of getting type 2 diabetes?
We need proper nutrition, food portion, mindful eating. When you're getting food and you think na baka madami na yon, most likely madami na yun kasi naisip mo na eh. Healthy practices on food choices, like reading labels and maintenance of a healthy weight is very important. Early detection and management are keys in preventing type 2 diabetes. For parents, it is also important to teach our kids healthy habits so that they can continue as they get older.
I don't know how true, but I heard that it's possible that type 2 diabetes can be in remission. Can you tell us more about that?
Well, currently, type 2 diabetes is still considered a lifelong disease. No? Meaning, once you are diagnosed with it, you can only control it but never cured. Although modern research show us that weight loss can actually cause remission of type 2 diabetes, meaning you can have diagnostic parameters that are actually considered normal. Although the endurance of the disease remission is still inconclusive, meaning hindi pa natin alam kung yung weight loss na nag-reverse or nag-cause ng remission ng diabetes type 2 mo, how long yung endurance na diabetes-free ka. Although we know that diabetes is not curable, we can control it.
So ayan, narinig niyo from Doc, although there may be no cure for diabetes, we can still make sure that we can effectively manage diabetes, whether it's type 1 or type 2, and these practices will also be very helpful when our children grow up. Now, Doc, before we do end our discussion, do you have any reminders or important takeaways before we would conclude our little discussion here for today?
Yes, Sam. To summarize our discussion today, here are a few things that we need to remember about diabetes. Diabetes is a lifelong disease. It can affect anyone regardless of age, sex, and status. Proper diagnosis is important as we can distinguish the proper medication to use for every case that we encounter. Diabetes is not a dead end. We can still live normally if we make the right choices. Parents carry the key to a healthy child through actively making lifestyle changes with food and physical activity, to bringing them to regular follow-ups with their healthcare providers.
Thank you so much, Doc, for joining us here for today. I absolutely learned so much about childhood diabetes management, and I hope that all of our audience did too.
Thank you, Sam, for inviting me.
Staying informed about diabetes is very important in helping our kids manage it. And to help us remember some key points from our discussion with Doc Chok earlier, we invited our very own Watson's pharmacist, Krem de Guzman. Krem, welcome to the show.
Hello, Sam. Hello, everyone.
You know, Krem, before we do get started with our little game, can you tell us more about what you learned from our discussion earlier with Doc?
Yes, Sam. So, marami tayong natutunan sa mga nabanggit ni Doc. Marami palang type of diabetes. But the most common types of diabetes are type 1 and type 2 diabetes. Kaya proper diagnosis is important para malaman natin ang proper medication to use for every case we encounter.
I agree with you, Krem. Very well said. And as we mentioned earlier today, type 1 diabetes is the most common diabetes diagnosis for kids. Knowing the signs and symptoms of this type of diabetes is crucial for early management. Kaya for today, we're going to play Sintomas. We're going to show pictures of possible signs of type 1 diabetes in kids, and you're going to identify what they are. Are you ready, Krem?
Yes, game.
All right, so let's have the first picture.
Increased thirst. This is one of the most common signs of diabetes.
Next picture.
Frequent urination, especially when it occurs at night, this may also be sign of type 1 diabetes.
And now for our last photo.
Being irritable or sudden mood or behavioral changes.
Wow, Krem, you got them right. And are there any more possible signs that we need to watch out for?
Yes, aside from those three, common symptoms of type 1 diabetes include overeating or extreme hunger, sudden weight loss, and constant tiredness. If you notice them, schedule an appointment with your pediatrician immediately.
Thank you so much for identifying those symptoms for us, Krem. And thank you, of course, everybody for joining us today.
Thank you, Sam, for inviting me.
When it comes to childhood diabetes, helping our kids start healthy habits to manage their condition early on is essential. And to support them in their wellness journey, you can find a wide range of essentials and equipment through the Watsons app and at 1,100 plus stores nationwide. For your kids' diabetes needs, find it at Watsons.
For more information about medicines, supplements, and health equipment, don't hesitate to ask your Watsons pharmacist.
Of course, don't forget to like us on Facebook, follow us on Instagram and TikTok, and subscribe to our YouTube channel. At Watsons, we have a wide range of supplements, fiber-rich foods, and equipment to help you on your diabetes management journey. Nutrin DiaPro Powdered Nutritional Formula is a nutritionally balanced supplement drink that helps control high blood sugar associated with diabetes and pre-diabetes. It's high in protein and fiber and gluten and lactose-free. Ensure Liquid Chocolate Ready to Drink is a complete and balanced supplement for illness and surgery recovery. It's a good source of protein plus 28 essential vitamins and minerals. Ensure Gold Vanilla Adult Nutritional Supplements is a powder drink that contains fiber for gut health, omega-3 for heart care support, and protein for muscle and tissue repair. It's also gluten and lactose-free. One Touch Select Plus Simple Bundle includes an easy-to-use glucose monitor and test strips that deliver accurate results in 5 seconds or less. AccuCheck Glucose Instant Test Strips are great for checking your glucose levels with your monitor at home. Anko Muesli cereal with strawberry and almonds are high in fiber and free from cholesterol and artificial colors. Anko Muesli Oat Flakes Big Leaves are rich in fiber and have a chewy texture. It also helps lower cholesterol and supports digestion. My Picas Myo-Inositol Plus Folic Acid is a dietary supplement powder that helps restore hormone and metabolic balance for women with PCOS. Ampalaya Plus Supplement contains ingredients that work together to help normalize blood sugar and cholesterol levels. BioFresh Diabetic Socks are specially designed by foot doctors to help protect feet from wound formation and other injuries. They're recommended to help reduce the risk of neuropathy and provide extra care for patients with diabetes. We have a wide range of health essentials and equipment for your diabetes care needs. Get them through the Watsons app or at 1,100 plus stores nationwide. I'm Samantha Fervor, reminding you that when it comes to anything you need to manage diabetes, find it at Watsons.